Hello, everybody. Welcome. I'm Veronica, the hostess of ADHD What Now? And tonight we are talking about vision and ADHD. And we have with us Dr. Samantha Slotnick, who is an amazing behavioral optometrist. This is an important topic. I know that I have personally met other friends who have had teenage kids where they had some vision challenges that were related to their attention as well, and they didn't identify it until high school age. And the reality is it can really be supported much earlier than that so that kids can experience more academic success and then, of course, the self-esteem that goes along with it. So I asked Dr. Slotnick to come on and share with us what were her top 3 things that she wanted people to know as vision correlates with ADHD. And she is going to get on and do that with us. Thank you so much for being here.
Thank you, Veronica, and I'm so pleased to be invited to meet with your community. And I think it's a great thing that you're doing to try to raise awareness for challenges that may bring up obstacles to attention and learning that can readily be addressed and are often kind of let go under the radar. And a lot of the time, the patients that we see who have attention problems that are interfering with their ability to focus and concentrate in an academic environment often have obstacles that include vision problems that can be brought to a lower level, or basically the vision problems being addressed helps to bring the attention problems to a more manageable level. So, the first thing I wanted to point out is that the symptoms of eye teaming problems, such as the diagnosis called convergence insufficiency, that's the one that is probably gotten the most press out there. If you were to look up convergence insufficiency, you might come up with several NIH, National Institute of Health studies about the convergence insufficiency treatment trials and ways that they have identified that this is a binocular vision or eye teaming problem that is readily treated and remediable. And so to the point that insurance companies tend to be willing to even pay for the therapy for kids who have convergence insufficiency because these trials have proven effective treatment with an active vision therapy program as opposed to passive or kind of a pseudo therapy program. So the studies were brilliantly designed. So the thing is that the symptoms for convergence insufficiency that affect learning are extremely similar to the symptoms for ADHD. A lot of the symptoms may include avoidance or difficulty with reading and staying attentive for a long period of time, tendency to avoid reading small print. Usually there's a lot of near-point work that kids are pushing back from because they are physically uncomfortable. So to know, first of all, the symptoms of these eye teaming problems and attention problems often look the same in a population of kids who are in school and spending a lot of time trying to learn within their arm's reach, basically to be able to read or attend on a computer. So to understand that, therefore, it's very worthwhile to have an evaluation that can rule out the underlying vision problem. I want to just add the caveat that regarding having that evaluation, a primary care optometrist may do a certain amount of screening for if they have sort of a family practice where they spend a lot of time with pediatrics, they may do some screening especially geared towards convergence insufficiency. But having an optometrist who's doing more of the pediatrically oriented work is definitely advisable for a school-age kid. The ophthalmologist is a medical doctor who specializes in the health of the eye, and so they may actually screen and evaluate that the eye is very healthy, but because they're not managing the near-point vision and learning problems, oftentimes they may clear a patient as not really being treatable or not needing or benefiting from glasses that I may actually have a very different opinion. And it's not that they are wrong because they may have a different opinion, they have different training, but so I'm not saying that that's wrong, but sometimes it's like that child may not need the glasses, but they may very much benefit from the glasses. So that's an important difference, that having a lens that lowers the demand makes things a lot easier. So the second thing I'll mention is really that the children who have both attention deficit and vision problems can reduce obstacles to that learning and reduce attention span with these appropriate glasses supporting the near point work and attention. Really just to land that there are binocular vision problems that look like attention deficit disorder, and kids who have both of those issues, both attention deficit and binocular vision problems, often can manage for a much longer time span when the vision problems get addressed. And the third thing, which I think is the most valuable thing to take home, is that there is a single most common complaint among the children who have, or the parents of the children who have a vision problem and also have attention problems in the classroom. These parents tell me that their child is smart in everything but school. That is the main differential that tells me that it may actually be a vision problem and that attention may be a byproduct affected by the vision problem. Because when you have a kid who will sit for hours on end playing with Legos and creating whole cities, but then won't sit and try to read a book, that sounds to me like there is a different challenge that is making it difficult to coordinate the eyes as a team on flat paper. That's a very different scenario than working in three-dimensional space, and also that the attention that it takes to do the building and creative projects is, that's one of the things that tips off the other behavioral optometrists that maybe there's a vision problem that is really not an attention problem, because we see that these kids can really do well. So if your child has ADHD, then it's worth ruling out the vision problem. And if your child is smart in everything but school, then it's really also very valuable to get that evaluation with a behavioral optometrist.
Awesome. Thank you so much for sharing that. It's really valuable. And I know that you have a heart for helping just kids be successful, but to the best of their innate abilities. So I'm really glad that you took the time to share that with us. And I know that you have also a link, and it's in the comments, for if people want to learn more about this. Can you tell us a little bit what they'll find if they click on that link?
Terrific. Absolutely. I set up a bit.ly link, which is bit.ly/Dr. Slotnick talk. And it's a link to a site on my website where I have a discussion that was aired on TV a little while back. The link will actually break down the entire 30-minute chat into all of the topics. So it's a very thorough outline with hot links directly into the conversation at any of those points. And one of the things that I think is really relevant is that this was done in honor of August being National Children's Vision Learning Month. And there was a children's vision survey, which looked at at over 75,000 children. I'm sorry, a national survey on children's health. More than 75,000 children were in this survey. And they found that there was an enormous correlation between attention deficit hyperactivity disorder and vision problems that are, quote, not correctable with glasses or contacts. And what that means is functional vision problems rather than just being nearsighted or farsighted or any such thing. So those are the problems that have a very high correlation, whether it's a tracking problem or an eye teaming problem, not only convergence insufficiency, but any one of those visual challenges in function really creates a blockade for kids who otherwise are eager to learn, curious, want to know about their world, want to be successful, want to do well and feel good about themselves in the classroom, and would be happier getting attention for being really good and standing out than for being a distractor in the classroom. So, I really do have a big heart for these kids who are having a hard time, and they just haven't been seen for the challenges that they have or understood and interpreted for the school to be able to process that. How do I help this child?
Yeah, absolutely. It's not easy, but I'm glad we're like able to help spread the word. And the question that we have, I think you might have kind of answered it, which is, can a child still have 20/20 vision? And is that checking something different?
Yes, it is, and yes, they can. In fact, the kids with attention deficit problems usually have 20/20 vision, because one of the reasons that a child's eyes may start to bias away from that is that they may redirect their attention towards seeing more intently at near point and sitting and working really hard. That may take them into the realm of becoming nearsighted. So most of the kids who have an attention challenge are not getting their eyes geared towards sitting and focusing on books, for example. So it's that the 20/20 vision at distance is very typical. That means that all of the screenings that are done at the pediatrician are where, okay, your eyes are fine. That may be true that the eyeballs themselves are healthy, but that does nothing to screen for how the kids need to use their eyes in an interactive eye-hand coordination environment in the classroom. So pediatric screening, I guess I would just want to point out this. 20/20 vision suggests that the eye is healthy, because a healthy eye should be able to have 20/20 vision. So it's not an unimportant thing to note, because it suggests that the pathway is clean and clear. But beyond that, being able to spend as long as you want to read an eye chart, if you can get your eye on the chart long enough and see it across the room clearly, it really has very little to do with the skills that we use in school for shifting between the board and your notes and back and forth, or for being able to track while reading while your eyes are also turned inwards, and that can be very uncomfortable. So they're really not the same kind of skills, and these often are not, they're not screened ever at a pediatrician. They're often not detected except in a very detailed school screening. Usually if it's run by an optometric organization, that may change the bar. Most of the time, you really just need a comprehensive eye exam, and we start as young as infants. I mean, we do infant evaluations to rule out vision problems in my office. So not that they need it yearly, but to make sure that there isn't one eye that's doing all the work for both eyes. That's an important thing to start early.
Yeah, I think that's what had initially brought me to you, because way back when I lived in a different city, somebody said you have to take your infant to an eye specialist to get them checked out. I was like, oh my goodness. So I brought one of my newborns to you, and also I met you because you very kindly gave a talk at a twin mother group, and I had twins, and I was just so impressed at the experience that you shared that helped me to really see what it is like when you are struggling with the types of things that you're talking about now. So anyway, thank you so much. That was incredibly valuable and important to know because of all the reasons that you've shared. So go check out, if you want to learn more, check out the bit.ly link, bit.ly/Dr. Slotnick, right?
Dr. Slotnick talk.
Awesome. Thank you. And to everybody watching, go check that out and benefit. So glad that you're here.
Thank you.
Bye-bye.